Welcome to Medical Monks, where your care is our highest calling. I'm Nikki, and today we're going to take a look at a product from our partners at Sanara MedTech. It's called HYCOL. HYCOL is an abbreviation for Hydrolized Collagen, and that's kind of a buzzword these days in nutrition mostly and skincare. You may or may not know that collagen is a building block for skin. You hear about it a lot with hair and nails especially, at least the girls do. If you're here, it's likely because you or a loved one is handling or treating a pretty serious wound right now. And our goal is to get you better, efficiently, effectively. So this product is going to help us to that end, and we're going to talk a little bit about this today. Some of the wounds that you might be facing, partial and full thickness wounds, burns. A lot of people right now struggle with diabetes and diabetic ulcers on their legs, and they're chronic. If you've been with us for any amount of time, or you've seen any of the videos that Penny or Adam or I have done prior, we talk a lot about prevention in terms of keeping our skin healthy. This is next level. The collagen itself in its native form, meaning untouched, isn't bioavailable. Our bodies can't actually use it. It's no good. It's useless. What Sanara MedTech has done is, through a chemical process using water, that's the hydro part, they have broken that down into 1/100th of a size that is native. So your body doesn't have to do any of the work to get the good stuff. What does the good stuff do? It actually provides a scaffolding inside a wound bed. And think of, well, roughly this size. This is 25 centimeters squared. So if you've got a pretty decent size ulcer on your leg, you're gonna need something in there that's gonna help actually create new skin, new muscle tissue. So that's what this stuff does. It provides a scaffolding for the new stuff to grow onto. So how do we get this good stuff into our skin? Well, there are a couple of different applications here, delivery systems, and it depends on what kind of wound you have. If your wound is seeping, and we call that exudate, and is a little bit more wet, you're gonna wanna use the powders. This is the 1 gram, and this is a 5 gram. I was curious, I wondered how much this actually covers. And it turns out that bottle will cover this size 2 to 3 times a week. And then you should be able to see significant healing. If your wound is drier, you're going to want to use the gel. The gel actually serves a couple of purposes. It provides a moist environment for the wound to heal, and it also gets underneath what we call tunneling wounds. So if you have a wound surface that actually has skin, and the wound actually gets underneath that border. One thing to point out, I suppose, about the powder is it actually uses your skin's own exudate, that seeping in the wound, to create essentially what this already is, the gel. It comes in a couple of different sizes and a couple of different quantities. And again, 2 to 3 times a week is about how often you want to use that and to see significant healing. Thanks for joining us. Be sure to like and subscribe below for future videos.